Since the outbreak of the coronavirus pandemic, the pathetic nature of the Nigerian healthcare system has become more glaring. The killer disease outbreak saw the federal government divert its attention from other deadly diseases such as cancer, malaria and hepatitis, among others. The Senate Committee on Health debunked the claims that the government stopped paying attention to other health challenges since the emergence of COVID-19. Chairman of the Senate Committee on Health, Ibrahim Oloriegbe, while briefing Senate correspondent on the 4th Annual Legislative Summit on Health, confirmed that only 50% of the 500 billion naira intervention fund for COVID-19 has so far been released. He assured that the government is paying serious attention to tackling other dangerous diseases such as Lassa fever, tuberculosis, HIV and AIDS, among others.
COVID-19 is an opportunity for us to address our infrastructure, but it doesn't mean that we have closed our eyes to all other things. As legislators and interacting with the government, we continue to look at other issues. And when you say, your end question, COVID-19 is, there's no way as human beings, when we live, there will be another pandemic. It is when it will be. The only important thing is that how prepared are we for that pandemic? This one we have now is a viral infection. It could be any other kind of things, but mostly it's viral. But we are very prepared now because the particular test we are talking about is to test viruses. So if we have something like that, it will be very easy for us.
Speaking on the forthcoming summit on health, the lawmaker noted that the overall objective of setting up the legislative network was to effectively leverage statutory functions of the legislature in Nigeria for improved health financing towards universal health coverage.
To achieve improved appropriation to health sector by deepening the knowledge of legislators on economic, social, health and political benefit of improved health funding towards universal health coverage. To ensure prompt and adequate release of allocated funds by working with the lawmakers to make relevant central budget agencies accountable for fund releases.
The annual Legislative Summit on Health is a product of the Legislative Network for Universal Health Coverage, primarily constituting of legislators with members of the executive arm of government and non-state actors participating to provide institutional context focused on the health sector. Osaruonamen Ibizugbe, ITV News, Abuja.